Okay, now for this patient, at the nursing case management patient strategy level, the first thing we would want to do would be to inform the patient about the purpose of CBC, ABGs, and pulmonary function tests and why he would need it because of his sickle cell anemia and possible sickle cell crises. And we would also want to continue to promote and encourage periods of activity and rest because you want to improve circulation and make sure that the patient does not stay fully bedbound, whether in a crisis or not. So, even though the patient may say he feels tired with activity, you would still want to encourage him to do as much as he can and alternate between periods of activity and rest. You would also want to promote and inform the patient of the importance of maintaining an adequate fluid intake, a minimum of 2 to 3 liters a day. This will improve blood viscosity and decrease the likelihood of future sickle cell crises. And you would also want to stress the importance of relaxation techniques and proper stress management because high stress levels can increase the odds of a sickle cell crisis. And the main purpose of all those above strategies would be to help the patient maintain health, prevent or lessen the frequency of sickle cell crises, and promote recovery. Now, for the interventions at the patient level, we would want to teach the patient how to monitor his vital signs, such as his blood pressure, his pulse, and respirations, in order to recognize any changes that can indicate an impending sickle cell crisis, and also to get a baseline of what his normal vital signs are. That way we can also help identify an oncoming crisis and take measures to prevent that. We would want to inform the patient to report any changes in regards to pain, such as a sudden change in the character of pain, or experiencing new pain, such as sudden bone pain, which was not present before, and can also indicate an impending sickle cell crisis. And for this particular patient, we would want to teach the importance of repositioning as often as possible in order to increase tissue perfusion. And one important thing about this patient is that he is currently a full-time student, and depending on the classes, you may often be sitting for 2 to 3 hours straight, so it would be important to encourage the patient to take advantage of any rest periods or ability to step out, walk around a bit between classes, and to increase perfusion and prevent any sickle cell crises. We would also want to review what the client's typical diet is and reinforce the importance of including green leafy vegetables such as spinach and broccoli, and some citrus fruits such as oranges, lemon into the diet, as well as the use of any supplementary vitamins, all of which can help decrease the demands placed on the bone marrow, which can improve the production of red blood cells and prevent